Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all over the world. And this is a crazy special week for us. We are out at the 25th anniversary of the Seattle Study Club Symposium. Some of the best clinicians in the world in one place at one time. And if you're not here, I would strongly encourage you to think about being here next time. And I've got three of the best right here, and you do not want to miss this. So do me a favor, hit the share button, and we'll see you in a few seconds. Hey guys, welcome back to the Best Practices Show. Thanks again for watching. Again, we are out here at the Seattle Study Club Symposium 25th Anniversary Legacy Tour at the LaQuinta in Palm Springs, California. Just an incredible week. And one of the cool parts about this week is you get to be surrounded by influencers, great thinkers like these guys. And today we're going to be talking a lot about the perio aspect of the future, and I have three of the very best in the world. So I know who you guys are. Some of these guys know who you are, but if they don't know who you are, who are you?
My name is Jason Stoner, periodontist in Columbus, Ohio.
I'm Pat Allen, a periodontist in Dallas, Texas.
And James Woodyard, I'm a periodontist in Newburgh, Indiana.
All right, cool. Appreciate you guys being on. Okay, I have like a million questions we're going to ask, but obviously you guys are the foundation of everything. And as we were talking before we went on, one of the cool things, Dr. Allen, you said is that you've got very different viewpoints. You know, I asked you guys, I'd love to know the future of perio, how you see it, but then also within it, the uniqueness that each one of you have visions for your own practice and how you see your patients. So who wants to start first? I'll kind of dish that.
Well, from out there, I've been in practice for a number of years now.
Yeah.
I haven't added them up in more than 40, and I've seen the specialty of periodontics change over that period of time quite a bit, and went from a period of time when I opened my practice, I treated periodontitis, and I saw probably 35 new patients a month with moderate to severe periodontitis, and that changed over time, of course. So we're going through, I think, some changes now, and we always will be. So the field is not stagnant, and we learn new techniques. Technology is really pushed ahead. And we will see that what we do in our offices will change, of course. These two younger guys are probably at the top of the technology, where I may be lagging that area a little bit.
And I think that's one of the biggest advances which makes our field so exciting now, because the diagnostic opportunities and tools we're going to have in the next 10 years are absolutely unbelievable. I see our field getting much more medically involved with lab analysis that's involved in our treatment and our diagnosis, and utilizing your own autologous tissues and cells to help regenerate and keep teeth, away from what you mentioned, Pat, before, away from just putting an implant into saving a focus back to saving teeth again. And the biologic mediators that we're developing from our own bodies with stem cells is going to make that an absolutely very different landscape in the future.
Along the same lines of Jason, I remember the first time that I read in a journal that we could harvest our own cells and create our own tissue graft.
Yeah.
I was like, well, this is fantastic. And then I found out that was $30,000 to $50,000 to have that done. But now everything's coming down. Like, we saw a lecture the other day about how technology exponentially increases and exponentially decreases in cost. Those are some of the opportunities that we're going to see. We see this with PRP, PRF. It used to be very expensive to have done. Now it's very economical. And we use it constantly. Donor tissue grafts, which Dr. Allen has pioneered. And, this has been something that's been wonderful for us. But at the same time, I think as we get more and more into this, being able to use the patient's own tissue and own cells to regenerate existing tissues is where it's going to be. Something we were talking about earlier was dental implants. I think they're wonderful, but nothing we do lasts forever. And teeth are really a little bit more easier to fix than implants. So we're seeing the shift, like Pat was talking about earlier, that now maybe we need to spend a little more time and try to save a tooth than just making it disposable. The other things that we look at as a specialty is who are doing the procedures,
right?
And Kurt, I've talked before about specialties in medicine and dentistry, and we're very lucky in the United States to have a specialty system. In some of the countries in Europe, you don't see that, and I think that's at the detriment of the patient. I think the patient loses when they can't get the best care that they're providing. While some family physicians may deliver the occasional baby, it's usually the OBGYN that does the work. And that's what we're seeing. I think there's always going to be some people that try to do everything, and in some areas that's going to be okay. But it is concerning at times. So that's one of the battles that we have. But there's always going to be a group that's like the Seattle Study Club that's focused on interdisciplinary care, that's focused on collaboration. And the technology Jason's talking about doesn't also just extend into patient treatments, but also in the way that we can communicate. With Camtasia and videos and online collaboration, GoToMeeting, and we don't have to meet at each other's office anymore, and that has opened up a whole new area of opportunity.
Right, and go back to that, because obviously we're very passionate, all of us, about interdisciplinary care, but give us a little State of the Union, and then I've heard even people define that's the difference between multidisciplinary care, and how do you see it in the landscape right now, because it's a critical part that's in the best interest of the patient.
It's interesting, multidisciplinary means there's more than one discipline treating a patient. Interdisciplinary means that those disciplines are interacting and communicating and working together and coordinating their plans together. And we talked about this way back when Rick Robley kind of brought interdisciplinary therapy to the forefront, that common knowledge is very important. Even if you aren't doing the procedures, you need to know what's available and what can be done. And then at one point, when you really mature as an interdisciplinary team, you begin to think alike. And that's when you've really gotten to a high point in providing the highest level of care for the patients.
And that's not easy to do. I mean, it takes work. It's like any relationship. You've got to create a fertile environment. You've got to create a lot of trust, right?
I think the newest opportunity is, which will absolutely be part of all of dentistry, is our introduction of the medical colleagues into the treatment that we do. Even in the meetings we've had here, we've seen how the introduction of plastic surgery procedures to enhance our outcomes aesthetically, but also just the HbA1c test that you can take in office now. All of these technologies are going to require a medical input and a medical physician of the patient to help treatment go through and get these patients healthy, which is what our goal is. And that's what I love about the meeting, because the meeting, I mean, we learned this stuff 2-3 years ago, and just the idea of someone has a disease and taking a genome and substituting it to eradicate the disease or keep them from even getting the disease, that's the future. And our training will change so markedly just from those, and that's to me is the essence of the interdisciplinary care that we can provide our patients now. We can start now too. So.
Absolutely. And go ahead. I know you have some thoughts.
One of the key things is that over the time, I mean, I've not been at it 4 years, but I've been at it 15, and one of the things that I've learned, pretty much everything that we do, and especially the kind of medicine, is about inflammation. Whether it's gingival recession caused from inflammation of soft tissues causing bone loss or periodontal disease, inflammation is the enemy. And so we're treating all this inflammation in the mouth. But inflammation in the body, if you start looking at inflammation and how it affects the rest of the body, more and more and more, we're seeing the rheumatoid arthritis to heart disease. I mean, just you name it, there's influences.
Right.
And so we have to recognize that, and we have to communicate that to our colleagues, and they have to recognize that there's some issue.
There is
some issue.
And that's happening now. You know, we talk about interdisciplinary, and we confine that to dentistry.
Yes,
it's
correct.
really interdisciplinary now, is including our medical colleagues. And it's kind of interesting. This has been going on for a while now.
Yes.
This inflammatory background that's common to so many systemic diseases as well as oral diseases. I'm getting referrals from physicians now to give clearance before a patient has, for example, the most recent one, a kidney transplant.
Really?
And it certainly has occurred with orthopedic surgeons who want a clearance before they do joint replacement. Mm-hmm. Because if there's infection in the mouth and they're treating some other part of the body, you know, that's putting that site at risk,
right,
and the outcome at risk. So that's becoming recognized enough that I'm getting unsolicited referrals from physicians to get clearance that their mouth is healthy enough for that procedure.
And osteoporosis and other procedures, and that's it's funny because in the 80s we had a multidisciplinary approach in dentistry that has become too slowly, but it's become more interdisciplinary in its approach,
right,
with things like Seattle Study Club and other study clubs. But now we're still in a multidisciplinary phase because we haven't totally included that medical. Mm-hmm. So they're treating inflammation separately than the way we're treating inflammation.
Yeah.
And putting that together, I think, is going to be an absolute a win-win for everybody.
And it's developing. I mean, we're seeing it's been some years of trying to make that contact with the physicians.
Right.
And it's starting to become a two-way street. So that's good.
It is very good. And this has been the common theme all this week. I think everybody has been 100% in agreement with this. There's never been a more exciting time to be. I mean, would you agree?
Absolutely.
I mean, and tell us why. I mean, you've gotten a chance to see all of these people develop. You're a great mentor to so many people here. Yes. Like, tell us why that statement is true for you.
Well, the curious thing is, I was asked to give a talk some years ago for the 25th anniversary of the founding of the perio department that I was a founding member of in Virginia. And the first person who spoke said how the golden age of perio was over.
Yeah.
Because of certain reasons, and it related to busyness.
Yeah.
And I felt kind of bad for the residents in the audience. And so instead of giving the lecture I prepared, I got up and I talked about, you know, today's the golden age of perio. And this was I'm talking 15, 20 years ago.
Yeah.
Because we have so many more things we can do for our patients than we had. We used to only have resective surgery in perio. Yeah. You excised. Yeah. You did osteosurgery, you did resective surgery. But then bone grafting came in, and regeneration came in, and then implants came in, and on and on and on.
Right.
And that's going to continue.
Yeah.
So I said to the group, this is the golden age. This is the most exciting time to be involved in periodontics as a specialty. Mm-hmm. And I don't want to think about leaving the profession. Retirement's the furthest thing from my mind.
You can't.
Because it's too...
We won't let you.
It is just, I don't want to miss out on what's coming.
Yeah.
Because I think the future's very bright.
Yeah. James, what do you think? Like, I love hearing from you.
It's... I get a lot of friends that get very worried, and their biggest threat is because they feel like that people are trying to take things away from them.
Yeah.
And they're getting more and more competitors, whether it's a general dentist or a oral surgeons or whatever. And it's just silly. We can all get along. We should all work together. It's for the benefit of the patient. And I see it growing and growing. And the thing that we have to do is we have to make people aware.
Right.
Because think about it. If you were a general dentist and there's only so much time in the day.
Right.
So your continuing education is probably going to be more focused on things that you do in your practice to try to make you better at what you do. And sometimes you forget, it makes me better at what I do to learn what we do.
Right.
Or somebody else does. But it's our job to get out there and make them aware.
Yeah.
We do things like treatment planning sessions in the Seattle Study Club, which is one of the best ways.
Yeah.
So we show a case. We go through the cases. We show them things that we can accomplish. So we're not necessarily preaching to them about what they should be sending for.
Right.
But we've got to raise the awareness in a good way, in a way that's beneficial, that we're working together. And if we keep on doing that, I think everything's going to be great.
Yeah.
I really don't see it as doom and gloom. And some people, when they come to me with that, I just kind of laugh. And I'm pretty busy.
Yeah. Yeah, absolutely.
And things are good. And I'm very blessed to be that way. And I'm lucky because I get to collaborate and learn from meetings like this with great mentors. I was lucky to find one of those.
Yeah.
And then great friends that also act as mentors. And so we just got to keep that up and keep it growing.
Yeah. And Jason, your thoughts on this time for you?
You know, from a bigger approach or a bigger look on this, I've always been someone, and I know you all have been the same, who comes from abundance. Mm-hmm. I don't understand the scarcity mentality because the technology and the things that are coming out are happening so quickly. I'm becoming antiquated, and I can't even keep up with it. So the opportunities are huge, and I think Jim Janikowski, I mean, just using substitution of teeth in young children, which avoids implants later and saves their smile for the rest of their lives. You know, his willingness to show how you need to sometimes step and think out of the box, and the tools available diagnostically now and from a therapeutic approach are giving us that opportunity to be more comfortable doing that, and which will progress the treatments that we can perform. So I think it's an incredible area for all dentistry, and a future era, and so I'm very excited because of that.
Yeah, and I have a special place in my heart for the periodontists, as we were talking before, because you guys are like thinkers. You have to think. This isn't a profession you get out and it's given to you. You got to think. You've got to be in places like this. You got to find great mentors, which is a hard enough thing. But I want to dispel, like, what do you think are some of the biggest misconceptions? Because there are misconceptions about perio and its role. Like, what are some of the things that you run into and you go, no, that's not true, and you spend half your day going, no, you know, like because really the quality of your thinking determines how far you go in life. But what would you say when it comes to misconceptions about perio or interdisciplinary that you would say, hey, look, I'm just quick to say this? Anything come to mind?
The first I would say is that it's a dying specialty. I think it's the most dynamic specialty. What we do involves every field, every aspect of dentistry, and now doors are opening to medicine as well. What we have to know to be provide a standard of care and level of health that's possible to our patients now is ever increasing.
Right.
And so I think it's so exciting to see how these new opportunities are changing the way we do things. Our training is very diagnostic in nature. We get it hammered into us about treatment planning and diagnosis and everything, probably more than any other field in dentistry.
Right.
And so almost everything that is done by every other field of dentistry and some medicine affects what we do and the care we give. Mm-hmm. And so we need to make a conscientious effort to embracing that and working well with our colleagues to make sure that keeps going. And that's, I think, the dynamics that it adds to the field I love. So
I agree. I think that periodontics became associated with implantology. Mm-hmm. So periodontists were becoming just implant specialists. Mm-hmm. And I think that's a misconception.
Right.
Obviously, periodontists are very involved with implant dentistry and are recognized as being among the best at placing implants and understanding where to place them and managing the patient afterwards.
Right.
So I think that's a huge factor. Periodontists have been accustomed to following their patients long term, and after they provide the initial care, to maintain that treatment and teach the patient how to maintain it and stay with the patient.
Right.
So I think the misconception of being just someone who places implants, I'm not sure how broad that is. Mm-hmm. You know, I don't see it in my area as such a problem. I think the periodontists are recognized as the ones who take care of their patients. And I think that's something that's a part of perio. The rest of perio, there's many other things that we do in perio, and I think that maybe the public's not as aware of that. Maybe there's been this association with implants that is masked the other things we do. Mm-hmm. And part of that is, of course, alluded to soft tissue surgery.
Yeah.
And correcting defects around teeth and also around implants, existing implants. So it's a broader field than it might appear.
Right.
Would be a possible misconception.
Yeah, and James, what are your thoughts on any misconception? Because
to kind of add with what Pat was saying, like I was saying before, I feel like that I relate a lot of things to my patients in terms that are easy for them to understand. They always ask me, what do I do? And I said, well, you're trying to build a house, and I've got to make sure your foundation isn't built on quicksand.
Yeah.
So everything that we do builds the house.
Yeah.
A lot of times the house may get built before the foundation is checked,
right,
or before that's addressed, because majority of things that affect the foundation, the periodontium, the supporting structure around the teeth, when you have problems, they don't cause you pain as a patient until it's really far along. And oftentimes by the time you get to that point, you're in a lot of pain with a large abscess. It may be too late.
Uh-huh.
And so, you know, we have a lot of patients that if it isn't hurting, it's okay. Mm-hmm. It's okay. And I think that they need to be, the consequences of non-treatment need to be communicated a little bit better of what we do. You know, severe gingival recession, periodontitis, and sometimes that they aren't. They're patted on the back and be like, oh, it'll be okay, we'll check it next time.
Yeah.
And so that's a misconception of the public, and sometimes a misconception of the dentist.
Right.
That they say, oh, well, you know, that's been okay for this many years. But if you really go back and check these situations, they may have been progressing a little faster than you think. Mm-hmm. And so if it doesn't hurt, you're okay. If periodontitis hurt, I would always say there would be a whole lot more periodontists in the United States.
Oh, yeah, absolutely.
Exactly.
Yeah.
Right. Absolutely.
Yeah.
Well, couple that with the fact that we've got an aging population. It's more exciting now than ever in dentistry. Digital, I mean, with the tools we have now, I mean, the landscape is incredible in the future. And what do you see with all of these? Can you ever remember a time things have changed this fast?
No.
Okay. Put all those things together, and like Diamanda said on Monday, that was a great lecture because things are getting better. We spend so much time on this doom and gloom, but there's a lot to celebrate about the next 20 years of dentistry. You know?
No, absolutely. I mean, the technology is making things easier and more affordable, as we brought out, and everybody benefits from that. So I don't think that there's doom and gloom. I don't see doom and gloom at all.
Right.
I see a bright future, and I think that the tools, especially from this meeting, all of the diagnostic tools that are coming out from a technology standpoint, they're doing what I think as dentists we're supposed to do, and that is comprehensive health of the patient. Mm-hmm. And that is, a patient comes in and there's evaluation of their occlusion, their function, their teeth, their gums, their jaws, everything, the pathology, all of those things are checked off in a protocol, and sometimes you just need a filling.
Right.
And that's still comprehensive dentistry, because we're going through a protocol that is summarizing the overall health of the patient, and then using the interdisciplinary component to capitalize on that by bringing in colleagues where we need them. I think that's what this technology is bringing with it.
Yeah.
And so I'm excited
Jason,
about
another
that.
thing with that I was looking at this morning, or yesterday morning, John Quest is presenting some of the software. You know, when I go to my physician now, every one of the hospitals in my area, they have the same software. They check off the same thing. They have a standard protocol of how they go through their diagnosis, the dismissal and everything else. I think that one thing that technology may do is to set some hard standards, to say, and to set these maybe even protocols that we can use to communicate back and forth, to speed up care, because I know that I can log onto my phone right now.
Yeah.
And I can look and see what was my last blood levels, this and that. This type of communication is going to be better for everybody, because everybody's going to always speak the same language. And that's where we need to get. Everybody speaks the same language. There's a continuity of care. I mean, that's going to be some great things.
Yeah. Absolutely.
Communication.
Yeah.
Absolutely. Well, and the underlying thing here too, I want to ask both of you, and how it relates to you, Pat, is like, you know, we have so many young dentists, especially when you speak to dental schools, and I'm sure you do. You can see how stressed they are. They're confused, stressed, and finding a mentor, coming to a meeting like this, it's critical to your survival, I think. Now, it's different. The landscape has changed. We don't have the openness we used to, but being a young dentist, what would you say to a young specialist coming out in perio? Like, where do you need to start? Like, because there's so many things coming at you. Where do I find a mentor? How do I get an opportunity that the two of you had to hang around with that? Like, that just doesn't happen every day. But you didn't sit around and wait for Pat to call you. Did you? Like, what would you say to the young?
I didn't answer it a few times. I was like, okay. He's calling again.
Yeah. So
I've told this story a few times, Pat.
Okay.
I don't know if you remember this or not. So my research, my master's thesis was on Alabama.
Okay.
And so I didn't even know that he had read my study. And so I'm walking through I think the first perio meeting after I'd gotten out of school, and with my new group that I was with, and I was the young associate, and I'm starting to hear this, James Woodyard. And I turn around, and there's Pat.
Yeah.
Because I want you to come over here. I want you to look at this new design of this instrument. And that was the flat-bladed tunnel instrument.
Okay.
And I'm telling you, my head went from here to here. Just like that. It was instantaneous.
Because he knew your name.
Yeah, he did. Yeah. And so, we started talking, and the thing that's great about Pat is that he listens to all my dumb ideas.
Yeah.
And he doesn't make you feel stupid.
Yeah.
And everybody, you can't, it's hard to find that. But
yeah.
Any other mentors I've found, like when I would go to a meeting, got a bug there, and I would see a great lecture, I would wait till the end of the meeting, wait till they got done with all their questions, and I would go up, I would say, my name is James Woodyard. I think that was a great lecture. Just wanted to shake your hand. I said, if you ever have any time, I got a couple questions for you. They will always make questions for you.
Yeah.
And now if you get something negative back and you're like, well, I have too much time, well, then move on. Find somebody else. Some people aren't ready. But you got to make the effort.
Right.
And majority of people approached in a good way, that's going to be a win-win, that you're not just trying to suck out energy suckers,
yeah.
Then I think you're going to have a good experience. But you have to be active in finding it. And find people that are smarter than you.
Yeah.
And you find people that are smarter than you, eventually you would be smarter.
Absolutely. Absolutely. There's a lot of truth that you don't want to be the smartest guy in the room.
Oh, yeah.
If you are, you're in the wrong room, right?
Yeah.
Well, how was your experience like, James? Or how did you get connected?
I would say the first thing you want to do is to decide and write down what is it you want from your career and what is going to satisfy you.
Right.
And then seek those opportunities that will satisfy that. For me, it was study clubs, and being involved in study clubs and directing study clubs and bringing in incredible mentors like Pat is for me. It was the way it really helped me shape what I wanted to be when I grew up, what I wanted my practice to be.
Right.
What I wanted my focus to be, and because there are so many choices: academics, clinical. What do you want to do? Right. Lecturing, and Pat happens to be phenomenal at all of those. And I had to go under the knife and have him do grafting for him to know my name. But otherwise,
is it a different experience in being in the chair this way than it is this way?
Of course, it is, and. But the experience I had with Pat was just another example of how do I want my experience to be for my patients.
Right.
And I knew what was happening. I knew what he was doing. And I was having the injections. I knew I was watching on the video because they were videotaping it to another room.
Yeah.
And but just the eloquence that was done and how well Pat just treated me with delicacy but effectiveness was I said I want that. That's what I want for my patients, and that's what I want to excel at. And so being part of some other study clubs and everything that graciously he's included me in, it's just made me learn a lot about what I want out of my field and my practice, and I can't imagine not being part of these study clubs. And things like Seattle Study Club, which also provides a network and a mentorship that is unparalleled in dentistry, really. So for me, that's how I found my mentor, and I think that's the best. I can't imagine coming out and being on a lonely island, not having that experience to help me grow quickly and let my patients benefit from it.
Yeah, and I want to come back to the study club thing, but I'm going to ask you as the mentor, it's got to be, you have to experience a lot of joy when you look at these two little kids that have grown up into fine young men. You've watched their growth, and what's your perspective on that?
Well, I'm going to go back first to just, I think there's more than one way to to find mentors.
Yeah.
And what I did, I went through my Perio program and I read the papers, the articles, and I knew those names. And I made it a point to go to the Academy Perio meetings where these people were speaking.
Right.
And I could associate a face with the articles that I was reading. And then I made an effort to meet those people. And some of them have been supporters and mentors to me from the time I was in graduate training. Actually, I didn't wait till I got out.
Right.
During my Perio training, of course, went to the Academy Perio meetings. I met Bob Shellhorn early on. He treated me like I was special and he wasn't. And he was like a god to me. And Jay Siebert, same thing. Jay Siebert was so nice and so kind to me. So that rubbed off.
Yeah.
I mean, not just their Perio knowledge, but their personalities and their demeanor, the kind of people they were. And I think I would advise young people to follow that example. Go to meetings and don't be afraid to go up and meet these people.
Yeah.
There was a classmate or year apart in dental school who said to his dad at a really important meeting, he said, "Dad, I'm really, I feel funny. All these people were my teachers. I feel a little, ill at ease." He said, "Oh, son, the bigger they are, the nicer they are."
That's true.
And so that stuck with me.
Yeah.
And so you start like that. One thing I did early on to get to know the leaders was I started a meeting, an annual meeting, a ski meeting.
Yeah.
And I invited some of the top leaders in Perio to be the speakers.
Yeah.
And so we designed it so we had some lecture time and then ski time, and I would make it a point to ski with them, to ride the lift with them, and get to know them. And that's a way. I wouldn't think everybody should go out and do that, but you can certainly go to the meetings and meet these people.
Sure.
And then you turn around and give it back.
Yeah.
And you spot the young leaders who these two guys were at that time that had the potential, and I wanted to expose them to the things I'd been exposed to.
Yeah.
So that's all I did for them, was just come here and get involved with this, learn from all these people that I'm bringing to the meetings and that others are bringing to these meetings.
Yeah.
And the study club is the easiest place to do that. The Seattle Study Club's amazing.
Yeah.
And Michael Cohen deserves tremendous credit for figuring out how to make a study club work. Because back before Seattle Study Club, every periodontist was told to go out, when you open your practice, get a group of dentists together and start a study club and do lit reviews. Well, it's just like that. Lasted no time at all. I mean, you couldn't keep the interest up. Michael figured out a way to, a formula for making those effective, and then franchised it basically into this network. Yeah. And it is amazing. I mean, look at the longevity of it, the numbers of clubs. It's really provided a vital function. Yeah. And that would probably be the best advice to the young people, is get involved with a local Seattle Study Club. Yeah. It's a good starting point.
It's genius, and it's bigger than that. It's become an important part of our lives. I mean, there isn't a whole lot of handshaking here. There's hugging. I mean,
that's right.
It's not, you don't say, "Good to see you." You're like, "Oh, where have you been?" Like, these are people you love. You love them dearly, and you need them in your life. And that's magic.
This is my 12th meeting, and I was walking over here this morning. I'd forgotten my name tag, and there was this guy that was a brand new director. Yeah. He said, "You forgot your name tag." I'm like, "Wait a minute." What do you mean? So I walk in, as I walk in, James. And it's just like you're coming back for a reunion every year. Every year. And that's the great thing about it. Yeah. And get a lot of new ideas, a lot of energy. I mean, the two best meetings that I go to are the ski meeting and this. Yeah. Yeah. Now, I get these questions all the time. I'm sure you get them. You guys both have your own study club. Pat, do you have yours, or
I'm in one.
You're in one. So, and you run them, okay? Yes. And it isn't, people always ask, well, do I go to Seattle? Why would I want to, give some clarification. If somebody's watching this and they're in dental school, what is a Seattle Study Club? You're in Columbus. Yes. You're in Indiana. Like, what is it? How does it work? What do you do?
Yeah. So for me, it was actually a gentleman, Fred Sakamoto, who's another periodontist in town in Columbus, who had a Seattle Study Club. And he said, "Jason, we went to lunch." And he said, "You need to start one of these clubs." Yeah. His club was bursting at the seams, and the desire by everybody in the dental community to be involved in something that organized was there. And I said,
"Now, time out, because we know Freddie.
Yes.
This is another periodontist in your same town.
Right.
Who's
Absolutely.
like, we need to do this together, which doesn't.
Yeah, it's amazing.
It's a different way of thinking,
And that's the community.
Right? Yeah.
That's the community that's with Seattle Study Club, with the Ski Club. These are people that are future leaders or already are leaders that are anxious to share and show abundance that is there in our field and pass on knowledge.
Right.
Without the idea of scarcity and without the idea of keeping it to themselves because it makes them look better than anyone else. That's not the point. The point is to be able to put all this knowledge into a bowl and let it grow. Watch it grow as people add to it, more people that come in and add to this importance of this growth. And so that's what is I think great about Seattle Study Club. It's not a bunch of egos up there saying this is how good I am, beating my chest. So we started this club and I would say that we started this club from the standpoint of, look, this is not a marketing event. This is an event to share knowledge and get better,
right,
and to increase the level of treatment that we can provide to our patients. Our study club is called Sfumato, and it's an art term and from Leonardo da Vinci that basically means giving a deeper, richer hue to a painting. Well, we see that as taking the general practitioners, which I see as a specialty itself, the oral surgeons, the periodontists, the pedodontists, the endodontists, all of the specialties, oral path, they're all part of our study club, and they add to a deeper, richer treatment plan and a comprehensive approach to treatment. So that was my vision. I got that from Pat, really, and how he ran his clubs and how I saw him interact with other leaders. So that's how I started mine. But
mine was a little different. It was kind of funny. The local dental society came to me and wanted me to start a dental implant study club. And I said, well, that would be like me starting a partial denture study club. I said, that's just kind of crazy. I said, yeah, we would have 1 year and then we would be done.
Right.
And I just happened to be working with one of the implant representatives, and she brought this up. I had never even heard of it. And so I started looking at it, and this is pretty cool, and real skeptical. I'm a little skeptical sometimes. I don't know if you know that, Jason.
It's true. He waits for you to do something, and he says, no, Stoner's vetted this for me.
Yes, that's true.
And so
leap and the net will appear.
Yes.
Yeah. So then I said, okay, well, I'll start this up, and I didn't think, I was like, gosh, nobody's going to join this. Then all of a sudden, the first year we send out the mailers, I call some different people, and the first year I had 54 members.
Wow. Which is a lot.
It's a lot.
It's a lot.
And so, what the study club is we put on continuing education courses every month. And some of the courses are interactive amongst the members, and some of the courses are speakers like Pat and different other people that we bring in. But we organize it all. We try to make it to a theme. So every year we're looking at a different area of dentistry. The members pay a flat fee, just like they're paying tuition to go to school, because it's a university without walls.
Right.
If somebody's coming out of school and they're really wanting to do something like this, go to the Seattle Study Club website, click on it, tell them where they're at. It'll show you where the next study club is, and you can call up and find somebody.
Yeah, and Pat, you get to speak to a lot of them. So give us your perspective. I mean, you go all over the country and all over the world. You've got a captive audience. What do you see from your side?
Oh, it's what's been described. You have a group of people who have come together to increase their knowledge, to be better dentists, and to have some way, some means of doing that as a group. Right. And the Seattle Study Club formula facilitates that.
Right.
So, what I see in the majority is people who are eager to learn. But the other thing is kind of interesting. I'm not sure I should say this, but compared to some other dental venues, I'll put it that way. The audience is typically well informed.
Yes.
They've had other good speakers who they have been there to hear. It's not a social meeting primarily. There's a social side,
right,
but it's primarily educational.
Right.
And so you have to be prepared as a speaker if you're speaking to a Seattle Study Club group.
Right.
Because they will be more knowledgeable than the average dentist.
Yeah.
Which is why they're in the group. They're there to improve themselves, and it shows to the person lecturing that that's the case, and it's much more fun to lecture to a group like that.
Right.
So
Right. And it's brilliant in so many ways, but like you said, he's got Michael Cohen as the formula, but you also have the autonomy to run your own club and decide. You don't have to follow a format. You choose your own format, you choose your own theme, and you're like, this year we're going in this direction.
And all of the tools you could possibly imagine are at your fingertips, thanks to what Michael Cohen and his Sherpas have done, which you can only end in success if your goal is comprehensive planning and getting people involved that want to do exactly that better. They don't want to practice today or tomorrow the way they practice today, and that's what it's all about. So
it's a good way to express it.
I think so.
It is.
Yeah, thanks.
It is.
Thank
It
you.
is. And so I always like to end with a good thought. Like, let's go back to the young periodontist. What do you expect to see in here in the future? Just your predictions for the future. We've talked about how exciting it is, but what if I'm a young dentist watching this, what do you think we will see on the side of perio, interdisciplinary dentistry in the next year or two? Because it would only be our guess. But what would you see, or what would you like to see?
Oh gosh, what would I see? What would I like to see?
You go first.
John,
I'll jump
I'm
in
thinking
for a second.
See,
I would like to
Joe's kinda
see.
slow.
Let me vet this for you. Let me vet this for you.
He's going to vet your future, and then he's going to tell you what you want to see.
Right, exactly. Yes. No,
I wait for him to do it, then I just do it better.
That's what he does. He takes it, rewrites
that.
it, sounds much more eloquent.
That's good to have friends
I
like
would
that,
say, I know,
though.
absolutely. So, for me, I would love to see a lot more headway made with the medical community and what we do, because I think the faster that happens, the faster we can give better care to patients, and more patients will go through treatment, because they'll see this not only as, I have 28 teeth or 32 teeth and I can lose one, it's not a big deal.
Right.
They'll see it as a medical a component of their medical health as well. And so I would love to see major efforts moved into that direction in the next couple of years. So
that's exactly what I see. The near future you're describing, next year or two. I think what we will see and what I'd like to see are the same, and that is a closer collaboration with medicine.
Right.
And that patients will recognize, and they are showing signs of that already, that there is an importance about the health of the mouth as relates to the health of the body.
Right.
As they see that, then they're much more accepting of therapy. They listen to us in a different way. We're not just there to patch teeth. And it's developing right now. I think that will be a huge improvement for dentistry in the future and for the patient as well.
Yeah.
So I thought of something there. So it's what they were saying. Everything in medicine and health is moving more towards, instead of a reaction model, a prevention model. I mean, you're getting benefits from your health insurance if you wear a Fitbit and it shows you're doing so many steps and doing this and doing that. And I'm hoping that we can get that into dentistry, because people should be able to keep teeth for a lifetime if they're shown how to do it right, if they get the correct care and the right prevention. We integrate this in with medicine, and we're going to have a lot of healthy patients, which is going to benefit everybody. There's plenty of people out there that have things that need to be done.
Yeah.
We don't have to go look for them. We don't have to create situations. We need to help prevent, and we need to help safety.
Yeah.
We just have to be better at how we present that need to the patients, and I sum it up for us as, and I think for these gentlemen as well, is that on a good day we save smiles, on a great day we save lives, and that's what is capable. So what's keeping us from getting there? And it's communication. I think we need to improve that. So.
Don't be scared to tell people the truth.
Yeah.
Yes.
I mean, it's your patient's mouth. They have to understand we're here to help. We're the messengers.
Yep.
They've got to do it themselves. Be truthful with them. Be honest with them. Be fair. At the same time, be caring.
Yeah.
And it can be done. It can be done. And if that's done, and people understand what the risk and consequences, and what can happen, and what good things can happen, they're going to make the right choice.
Yeah. Absolutely.
So the future's bright.
Future is bright.
Very bright.
You heard it there from the experts. These guys are tremendous, and I thank you guys not only for your expertise, but your time, and most importantly, your willingness to give back. And really, that's what this whole meeting is about. Is like, there's just givers here, people that want to help you. If you haven't been, you got to go.
Please
right?
join.
You got to
Absolutely.
go. So,
right.
thank you guys very much for having us on. And so, thank you guys for watching. I hope you enjoyed this. I know you did. And if you did, do us a big favor. Just hit the share button and add some questions in the feed. If you have questions, we'll get back to you and give you the best answers. But until we see you next time, keep watching the Best Practice Show. We'll see you guys.